What is a colposcopy and why is it done for CIN? Imagine a tiny magnifying glass that helps doctors see inside your body more clearly. That's essentially what a colposcopy does. It's a simple outpatient procedure that allows your healthcare provider to closely examine your cervix, vagina, and vulva using a special instrument called a colposcope. This device has a light and magnifies the view, making it easier to spot abnormal or precancerous cells that might be invisible to the naked. A colposcopy is usually recommended after a pap smear or HPV test shows abnormal results. These tests can detect changes in cervical cells that might suggest cervical intraepithelial neoplasia, or CIN. CIN is a term used to describe abnormal cell growth on the surface of the cervix. It's important to understand that CIN is considered a precancerous condition, meaning it has the potential to develop into cervical cancer if left untreated. But with early detection and proper management, the risk of progression can be significantly reduced. During the procedure, the doctor might apply a mild acetic acid solution or iodine to the cervix. This helps highlight abnormal areas by turning them white or changing their appearance. If the doctor notices suspicious spots, they can take small tissue samples called biopsies. These samples are sent to a lab for analysis to determine whether the abnormal cells are indeed CIN and how severe they are. The severity can range from mild changes to more advanced precancerous stages. Colposcopy plays a vital role in diagnosing and assessing CIN because it guides treatment decisions. If biopsies confirm CIN, the doctor can recommend appropriate procedures to remove or destroy the abnormal tissue, preventing it from developing into cervical cancer. It also helps monitor the effectiveness of treatment or check for recurrence after therapy. Additionally, a colposcopy can be used to investigate other issues like genital warts, inflammation, or unusual bleeding. The procedure usually takes about 10 to 15 minutes and doesn't require anesthesia. Some women might experience mild discomfort or spotting afterward, especially if a biopsy is performed. Serious complications are rare, making it a safe and effective way to catch early signs of cervical changes. In the broader context of reproductive health, early detection of CIN through colposcopy is crucial. It allows for targeted treatment, which can prevent the progression to cervical cancer and help preserve reproductive health. Remember, if your screening tests show abnormal results, your healthcare provider will guide you through the next steps, including whether a colposcopy is needed. Always consult with a medical professional for personalized advice and care.